Let's examine Chapter 6, which is on eruption and shedding of the teeth. So, when we're looking at teeth, what happens is they start to form under the gum. So this is the gingiva. The teeth start to form under the gum. You can see the crown is starting to be made. That is known as your pre-eruptive stage. Pre-eruptive because it hasn't erupted yet. After the pre-eruptive stage, we have here it says the eruptive stage, but it can also be called the pre-functional stage. And so what's happening here is the teeth or the tooth is erupting, but we can see it's not fully formed. The roots haven't fully formed and it hasn't completely made its way up. So that is known as the eruptive stage. But in the textbook, what we're going to actually use, the term we're going to use is the pre-functional stage. So it's pre-functional because you can't really use that the tooth properly because it's not functional yet. The only way it'll become functional is when it's fully up and fully developed. So this is your functional stage, or some people will call it the post-eruptive stage, when it's fully up. And what usually happens is when it is fully up, the top tooth can like hit nicely with that. It comes into nice occlusion or context really nicely. Okay, so again, 3 stages that we're going to look at. The pre-eruptive stage, where the tooth has not erupted through the gum line. The pre-functional stage, where it is starting to erupt but hasn't fully erupted, and then the functional stage where the tooth finally fully erupts. So let's look at the pre-eruptive phase. The pre-eruptive phase, what happens here? This is the time of early initiation, so it just starts to get formed. The crown gets formed. And it goes all the way till the crown is completely formed. So it starts to get formed and then it completely gets formed. That's the pre-eruptive phase. This is, if it's fully out there, this is like functional when it's fully up there. But pre-eruptive is when it hasn't broken out yet and the crown is being made. Up until the crown is completely made, that is the pre-eruptive stage. So this is your pre-eruptive period. So what happens in the pre-eruptive phase? What happens in the phase where the crowns are being made? The crowns, they consistently move. Okay, so these crowns, they're moving, these crowns right here, they're moving consistently. And the reason they're moving is because the face is getting bigger, right? The face develops, it develops forward, it goes downward, outward, right? So the face develops, and when the face develops, the crowns also kind of move with the face. Also, the permanent tooth crowns, so the crowns that are underneath, they are trying to, erupt, and then they also make the crowns move in a specific way. So with this, so many changes happening with the face growing and with the permanent teeth coming in, the crowns do shift here and there. They do move constantly in the jaws. So what I want you guys to know is that when we're looking at the permanent, so the adult, front teeth or anterior teeth, they actually develop lingual to the primary teeth. They develop behind the primary teeth, as you can see here. Typically what normally happens is these teeth would have been shed, would have been lost, so that the permanent teeth can get into that space. But if for some reason that doesn't happen, then it's developed lingually. And then what happens is once this tooth is lost, the tongue is a very strong muscle, right? So the tongue will eventually move those teeth forward. The permanent premolars, what happens with that is so this is the permanent premolars, they replace the baby teeth, the primary molars. So the primary molars are replaced by the permanent premolars. And then the molars, okay, so the maxillary molars and mandibular molars, they just form at the very back. They don't replace any baby teeth. They don't replace any primary teeth. They just get formed at the back. And what you'll notice here is when you look at the maxillary molars, from max means upper jaw. So when you look at the maxillary molars, if you look at their occlusal surfaces, so the biting surfaces, is actually slanted distally to the back. It actually slants a little bit that way. And if you look at the mandibular molars, which is at the bottom, they actually slant mesially, so they go towards the midline, whereas the maxillary molars, if you look at it, it's kind of shifting backwards, right, distally. Okay, what else do we need to know? With the pre-functional stage, the pre-functional eruptive phase, where it hasn't fully broken out through the gum line, there are 4 major events that are going on here. And they're all listed here. So root formation, the root is going to, start to be made. Okay, so the root will eventually be made. Movement to reach the oral mucosa. So the tooth is eventually going to go up and reach the oral mucosa, or the gums. Okay, it's going to go up and reach the gums. And then finally it's going to penetrate. It's actually going to, go through the gums and get up there, penetrate. And then it's going to go erupt until occlusal or incisal, until clinical contact. And what that means is until it hits the opposing tooth. So let's look at these in more detail, these events in more detail. So root formation, that is one thing that happens in your pre-functional eruptive phase. Okay, so this is all pre-functional eruptive phase. Okay, so in the pre-functional eruptive phase, this is where it's going to start to go out. Remember, 3 stages, right? So we have, just to recap, we have the pre-eruptive stage where it hasn't come out yet. We have the pre-functional stage where it's making its way out, where it's making its way up to erupt. And then we have the functional where it fully erupts. So what we're looking at right now is the pre-functional eruptive phase. So here, the root is going to start to develop, and the way this happens, and if you remember from our previous video and class, the epithelial root sheet that proliferates, that grows, and then it just allows the root to kind of get made over here. We get movement. That's another event that happens where it's starting to move up and up and up. Now there's something called the reduced enamel epithelium. So here's your enamel in white, and then right above the enamel is a thin layer of tissue. It's really hard to see, but there is a thin layer of tissue that's a little bit dark, and that is known as your reduced enamel epithelium. The reduced enamel epithelium meets and touches the oral epithelium. The oral epithelium is the outer skin right here, the outer skin on the gum. Oral means mouth, so it's on the inside of your mouth, and it touches. It fuses. The reduced enamel epithelium, which is this dark layer right on top of the enamel, touches the oral epithelium. Then we get penetration, where the crown is now starting to actually erupt, and it breaks that oral epithelium and it comes out. So this is the crown tip, and this part, the part that you can see clinically, is known as clinical crown. So the part that you can actually see, if you are looking inside someone's mouth and you just see the top part of the tooth, that is known as your clinical crown. This whole thing is a crown, the anatomic crown, but the part that you see is known as your clinical crown. And lastly, the last event that happens is intraoral, occlusal, or incisal movement. So intraoral means inside the mouth, occlusal or incisal. So occlusal refers to the molars and premolars, incisal refers to the anterior teeth. They kind of just keep moving all the way up until clinical contact, until the opposing tooth that's on top hits or meets the other tooth, the tooth right below it. Again, just to recap, the difference between clinical crown versus anatomic crown. Clinical crown is what you can see inside the mouth. Anatomic crown is the whole crown, which will eventually erupt. The clinical is what you can see. Now let's look at the tissues. So there are 3 types of tissues, and we're going to examine those tissues. So when we're looking at tissues, there are tissues that are overlying or above the tooth. So there's tissues above here, and we're going to see what happens to those tissues. There are tissues surrounding the teeth. So there's one like surrounding the teeth, beside the teeth, and then there's tissues underlying the teeth. So we're going to examine all of those tissues and what happens to these tissues as the teeth are erupting. Okay, so let's look at the tissues on top, overlying the teeth. What happens is we have a zone or an area of degenerating connective tissue fibers, and cells, which basically means that there's fibers here, there's like lines over here, there's cells here, and they're just starting to kind of fade away and degenerate. They're going away. these fibers are getting destroyed, the cells are getting destroyed, they're getting degenerated. And instead what's happening is there's something called an eruption pathway. This triangle thing that you are seeing here, this inverted triangle thing, that is known as the eruption pathway, so that the tooth, which is right here, can eventually go and come out that way. There's this cord right here, gubernacular cord, that you can actually kind of see here, that sticks out. And that gubernacular cord, some say that that is like a guiding point that tells the tooth that, it's like a cord that's kind of pulling on the tooth to come out and erupt that way. So within the eruption pathway, there is this cord, which is called the gubernacular cord, and that guides the way for the tooth to come out. Okay, we're going to look at some cells. So inside our body, we have macrophages. Inside actually the blood stream, we have these cells, okay? And so there's like macrophages, there's osteoclasts, osteoblasts. So let's just look at what these cells do. So these cells, macrophages, what they do is they, this is what a macrophage looks like. It's a white blood cell. They release enzymes, hydrolytic enzymes. And these enzymes, what they do is they destroy cells and destroy fibers. Why? Because when the tooth has to come out, all the stuff here needs to get destroyed. So macrophages are there, they're destroying all the fibers, all the cells, so that there is a way for the tooth to come out. So macrophages destroy cells and fibers. Osteoclast and osteoblast help, well, not help, but they remodel the bone. So let's look at the difference. Osteoclast, I want you to think of C for consume. They eat up the bone. Osteoblast, I want you to think of B for build. They build bone. So osteoclast, if there's bone over here, osteoclast is, actually you can see the bone, there was bone covering this whole area initially. Osteoclast is eating away the bone, so now there's more of a space so that the tooth can erupt. So osteoclast eats away the bone. Osteoblast then it'll build bone elsewhere. Again, just to recap, what happens is when we're looking at, this is the primary teeth and this is the permanent teeth. You can see the permanent teeth erupt lingually to the primary teeth. But when we look at the when we look at the primary molars, so these are the primary, the baby molars, the premolar, the adult premolar grows right underneath that. So the adult premolar grows right underneath the primary molars. With the anterior teeth, it grows lingually. With the primary molar teeth, the premolar adult tooth grows right underneath that. And you can see resorption is happening. Resorption means that so here there was a root, right? The root is getting resorbed, it's gone, so that the premolar can properly erupt, the adult premolar can properly erupt. And as it's erupting, it is resorbing the root over there. You can see there's supposed to be a root right here, but because it's pushing on it, the root gets resorbed by some cells, so that this can eventually fall off, and then the permanent premolar can take its space. So how does resorption happen? How does the root and everything get resorbed? There's osteoclast. Osteoclast kind of consume and eat up the bone that's intruding in that area. And osteoclast comes from monocytes. So there's this in the blood, there's a white blood cell, it's called monocyte. Monocyte makes osteoclast. And then osteoclast, they're the cells that eat up the bone. Remember, C for consume, C eats up the bone. It eats up the bone that we don't need so that the tooth can erupt. And if you look at the osteoclast, there's lots of nucleus in there, so it's called multinucleated osteopaths, and they resorb hard tissue, or they eat up the bone. And if you look at the shape of the cell, it has a ruffled border, which helps with the eating away of the bone. So the ruffled border kind of looks like that. Now, when it's eating away the bone, when we're getting this resorption happening, hard tissue, which is bone hard, right? Bone is hard. When we're getting hard tissue resorption or bone resorption, the eating away of bone, there's two phases that happen. There's the extracellular phase and the intracellular phase. In the extracellular phase, which means outside the cell, outside the osteoclast, what happens is if we look at it more carefully, maybe we can see it here. I'm going to zoom in a little bit so we can see this a little bit better. Okay, when we look at the osteoclast, this is the border of the osteoclast. Remember, it's ruffled. What we're looking at is it's eating away the bone, and you can see the minerals of the bone. They're just like hanging out outside the cell, outside the osteoclast, which is known as extracellular phase, because these minerals, they're broken up, but they're hanging out outside the cells. And then the intracellular phase is, let's just adjust this on my end. The intracellular phase is when, if we look at this image right here, when it ingests, when it eats up those minerals fragments. So now it's eating up the mineral fragments. So before it was extracellular mineral fragments were outside the ruffled borders of the osteoclast, and now intracellular, intra means inside the cell, and now the osteoclast is eating away, or ingesting, sorry, it's eating it, eating what? The mineral fragments. The two phases, extracellular, intracellular phase. In our gums, in our mouth, we have fibroblasts, okay, which are these purple cells. Now, what do fibroblasts do? They actually destroy and they make collagen fibers. So if there's a tooth here that wants to erupt, these fibers are in the way, right? The collagen fibers are in the way. So what's going to happen is these fibroblasts are going to destroy these collagen fibers so that the tooth can kind of go up and erupt. If we look at the fibroblast cell, it actually is really interesting what they do. They not only destroy the collagen fibers, but they also make collagen fibers. So these fibers right here, this is the collagen fiber. They're eating up. So you can see they're going into the fibroblasts. So fibroblasts are eating up the collagen fibers. Then we have amino acids. Amino acids are released. And what happens is amino acid kind of help make the new collagen fibers. So collagen fibers are getting destroyed. You can see it's being eaten up. It's getting destroyed. It mixes with the amino acid and it makes new collagen fibers at a later stage, at a later time. Okay, so now let's look at the overlying tissues again. So we're looking at the tissues that are on top of the crown, on top of the tooth. What we're going to see is here you can see there's a gap, right? So this is the oral epithelium, which is the outside layer of the gum, the outer layer of the gum. And here is your crown. You can see over here that the crown is starting to come out, right? So here what's happening is this is the pink layer that we're looking at. This is your reduced enamel epithelium, which is the layer that's right outside your enamel. This contacts the corners, which is known as your developmental cuticle. Okay, so developmental cuticle, that's the corner of the cusp. So the cusp is right here, the rounded mounds, that's over here. It connects with the developmental cuticle and it connects to the oral epithelium. And look, it completely fuses to the reduced enamel epithelium, the developmental cuticle, and the oral epithelium. They all join here. So here they're all joining in. And you can see it's nice and thick here, right? The oral epithelium is nice and thick. The outer skin or the outer gum is nice and thick, but it gets thinned out. So then thinning happens of the epithelium. And then rupture happens. So the epithelium goes away, it ruptures, and so now we can start to see that the clinical crown is starting to show up, is starting to appear. This is the pre-functional stage. Okay, so all this is the pre-eruptive stage. This is your pre-functional stage. It's starting to make its way out. And lastly, when it fully erupts, that's when it reaches the functional stage, when it's fully erupted. Let's look at what happens to the surrounding tissues. Okay, so the tissues beside the tooth that's erupting. If you look at the cervical area is along the neck of the tooth, so where the crown and the root kind of meet, right here. This is the cervical area, where you can see fibers are being formed. And then as the tooth is erupting, more and more fibers are being formed. These fibers, by the way, they're called periodontal ligament fibers, which there's a whole unit on that we'll look at later. When the tooth is completely functional, you can see that fibers are even formed at the bottom as well. So this is what it looks like when it's completely functional. So as the tooth is going up and erupting, there's these cells known as fibroblasts, and what fibroblasts do is they come in the fundic area. The fundic area is like the bottom area, okay? So the bottom area is where you'll see fibroblasts, and what fibroblasts do is they make these bony ladder, okay? So this looks like a ladder, right? And it's actually bone, and fibroblasts make these bony ladder. Eventually, these bony ladder becomes like hard bone. Okay, let's look at the functional phase. Functional eruptive phase is when it has fully erupted, okay, and the teeth are functioning. Interesting fact is when it fully erupts, if you look at the root for it to get completed, it can take a while. It can take 1 to 1.5 years for the root to complete after the functional stage for a baby teeth, and for permanent teeth, it can take 2 to 3 years for the root to fully develop. So root completion continues even after the teeth have begun to function. And it functions once the tooth hits the opposing tooth. That's when the teeth are considered functioning. Now, when we're looking at the functional eruptive phase, remember, we want occlusion to be established. What that means is we want the meeting of the two teeth, the opposing tooth and the tooth below, they need to meet. That's when you get occlusion. That's when you get the fusion of the meeting of those two teeth. Now, as they meet, as they hit each other, every time we're talking, every time we're chewing, the teeth are hitting each other, right? What can happen is it can create some trauma, if you will, and so it's causing some trauma that triggers all the way down or all the way up here and all the way down here. And so to compensate for that consistent hitting and that trauma, what happens is cementum, which is a part of the tooth, gets deposited at the bottom. So cementum gets deposited at the root apex, which is like the bottom of the root. So we have thickened cementum at the bottom. And this is there because it's compensating for that occlusal wear, because every time the teeth hit there, it's wearing down, and then it kind of can cause some trouble or some trauma to the bottom area. So it tries to compensate that by depositing cementum there, so it doesn't cause as much problems to the tooth. Now, why is it that the teeth are forced to go up? Like, how does it, get forced to go up and erupt? It's because the root's growing. So because when the root grows, it just forces its way up, and to erupt. And also there's pressure in the pulp. So we have a pulp in the tooth, and there's some pressure there. That's just the pressure is just pushing the tooth out. Humans are diphyodont. Diphyodont basically means that there's two dentitions we have. We have the primary dentition when we're, the baby teeth, and then we have the permanent dentition, which is your adult teeth. And there's a stage in our life where within a 4-year period, when we're having that mixed dentition, where we have both primary and secondary teeth, that our mouth can accommodate up to 50 teeth, which is crazy, right? 50 teeth won't be fully erupted in the sense that we won't be able to see it clinically, but if we were to take an x-ray of our entire mouth, you might be able to see up to 50 teeth within a 4-year period. Crazy. All right, let's look at shedding. So shedding means when we lose our teeth, when we lose our baby teeth. So shedding is when we lose baby teeth. And why does this happen? It happens because of the resorption of roots. So the root gets resorbed. See how there's no root over here? It gets, gone. That's one reason why the shedding of the primary teeth happened. Another reason is there was bone around the area here, and the bone goes away from osteoclast, so that's another reason why shedding happens. And lastly, the teeth can no longer withstand the chewing forces. You know, we can't chew on it. You know how when we're biting our teeth all the time, if you can't put any chewing pressure here, if you can't chew properly here or put any pressure here, that also is another reason why we're losing teeth. So these three reasons are why teeth are shed. Primary teeth are shed. Now let's look at the differences between primary versus permanent teeth, because they do look different. So the first thing to note is that we have only 20 primary teeth, but we have 32 permanent teeth. The permanent teeth that replace the primary teeth are called successional teeth. So the incisors, the incisors here, the primary incisors are replaced by permanent incisor. Those are known as successional teeth because there's teeth replacing these teeth. If we look at the molars, the primary molars are being replaced by permanent premolars. Permanent premolars are successional teeth because they are replacing this area right here. They're replacing the primary molars. There's also teeth that are called accessional, and accessional are teeth that don't replace the primary teeth. And those are your molars, your adult molars. The adult molars do not replace any primary teeth. The adult molars forms at the back, like behind the primary molars. And so because the adult teeth are not replacing any primary teeth, they are known as accessional teeth. Okay, so primary and permanent teeth, they are different in size and they're different in form. If we look at the crowns, for example, the crowns of the primary teeth are smaller. So if we look at the white crowns, they're actually smaller than the permanent crowns, which makes sense because baby teeth are naturally smaller. Another term that I want you guys to know is called the leeway space. So leeway space is the space between, so it's this shaded area right here. This is your leeway space. So here is your permanent first molar, which comes out when you're 6 or 7 years old. The space between the permanent molar and the permanent premolar, that space right here, is called the leeway space. Okay, so the space between the permanent molar and the space between the permanent premolar, which is eventually going to come up and erupt, there's going to be a space. So once this falls out, these teeth fall out, and these 3 teeth come out, there's going to be a space, and that space is known as your leeway space. And you can see the leeway space is bigger on the mandart compared to the max arch. When we compare baby teeth versus adult teeth, primary versus permanent, besides the fact that they're smaller, they have single roots. So if you look at the incisors of the primary versus permanent, 1 root for both, and they have an incisal edge. It's not occlusal, right? It's not occlusal means it's not a thicker edge, it's an incisal edge, a thin edge like this. When we look at the primary molars, you'll notice that the primary molar is actually bigger, has a larger mesiodistal diameter. So distal is here, mesial is here. It has a larger diameter compared to its permanent premolar. So the molar is bigger than the premolar. But the crowns of the permanent molars, so this is the permanent molar that comes out at 6 to 7 years of age. This is bigger than the primary molar. This, by the way, is the leeway space right here. So you can see right here, this is your leeway space, the space between the permanent molar and the permanent premolar. And eventually what happens is the mouth doesn't like any spaces. So the teeth will eventually shift mesially, goes towards the midline, and they'll kind of get rid of that space. Okay, let's look at the roots. If you look at the roots of the primary teeth, you can see they are shorter compared to the permanent teeth. They're also more divergent, which means they're more spread apart. They're wider, right? Whereas here, they're more closer together. Another thing to note is that when you look at the primary teeth and the permanent teeth, they have this a similar enamel prism structure. So this is your enamel. If you look at it microscopically, it has prisms. So this is an enamel rod or an enamel prism, and it has like a head and a tail. What happens is with the primary teeth, if you look at the top surface of the enamel, it's more prism-less. It doesn't have that many prisms. Okay, so there's less prism in the primary teeth, just on the surface of the enamel. But the pattern, the structure of it is the same, except at the tooth surface, except at the very top of the teeth. When we look at adult teeth versus baby teeth, the enamel is thicker in the permanent tooth. The dentin, okay, so the inside part underneath the enamel, the dentin is actually a little softer in the primary teeth, which means it's easier to get cavities in your primary teeth than in your adult teeth because these are much more thinner and softer. Let's look at the pulp size. When we're looking at the pulp size, if you look at the primary tooth, the pulp is larger. But if you look at the permanent, the pulp is smaller. Another difference between the two is that the permanent teeth, they have more nerves in the pulp compared to the primary teeth. Last slide, this is the arch shape. So the arch shape is similar. You can see they are similar, but with the permanent teeth, it extends more distally. It goes more back, and that's because the arch has to accommodate for the permanent teeth at the back. Okay, that's all you need to know for this chapter. Let me know if you have any questions.